"How you doing?" I asked as I walked into the room. Mrs. X was an 80-something-year-old widow, generally active and happy, living in her own home with her dog and with family nearby. Her response this morning, however, was not so good. "That darn old Arthur has been visiting over this last month and he just won't leave," she replied. "In fact, it's getting worse." The new discomfort was a symmetrical neck, shoulder, and hip stiffness, resulting in trouble getting out of a chair, climbing stairs, and combing her hair. "I can't sleep at night, and then I'm just so stiff in the morning," she said. Thinking that this might represent a fancy name condition that commonly afflicts the elderly called polymyalgia rheumatica, or PMR, I had the laboratory draw an inflammation marker called Erythrocyte sedimentation rate, or SED rate. Making sure this isn't a vision-destroying condition called giant cell arteritis, I asked her if she had any change of vision, pain in the temple regions of the head, or pain with chewing. She said no. It's important to ask about these symptoms because blindness can be prevented if giant cell arteritis is diagnosed. There were no temple pains or chewing symptoms, but her SED rate was sky high, which along with her story confirmed my suspicions of PMR. This is one of those wondrous diagnoses about which we can make a huge difference. And so we treated her with a daily 10 milligram low-dose prednisone to be dropped slowly later. When I saw her 3 weeks later, she was back to her usual self, working in her yard, smiling easily, and giving me back all sorts of fun guff. PMR occurs more often in people of Northern European extraction, and we should expect 50 cases per 100,000, or maybe 15 to 25 new cases in the Brookings and surrounding area every year. It happens a bit more frequently in women than men, almost never before the age of 50, with most cases starting around the age of 70 or 80. We don't know why PMR develops, but suspect it follows a certain kind of viral infection in a genetically predisposed individual. Some experts believe that PMR and giant cell arteritis are simply different levels of severity of the same disease, and both can be successfully treated once diagnosed. So if you start noticing terrible morning neck, shoulder, and hip stiffness, then you might greatly benefit by a visit to your doctor.